Gail Tremblay's voice carried down the length of the East Wing corridor with the kind of clarity that doesn't require volume. "Westbury, walk away from that man right now, or don't bother clocking out." Alan Westbury didn't walk away. He stayed exactly where he was, crouched on one knee beside the row of plastic chairs outside the cardiology waiting room, speaking quietly to an older man in a worn flannel jacket. And he kept his voice low and even, the way he'd learned to do in 9 years of working hospital corridors where people were frightened and trying not to show it. 7 months later, everyone in that building would understand what that decision had cost him. Nearly a year after that, some of them would finally understand what it had been worth. The Victoria Care Center sat on a tree-lined street in the south end of the city, close enough to the ocean that on clear winter mornings you could smell salt water from the staff entrance. It was a mid-sized community hospital, not a research facility, not a teaching institution, just the kind of place where people came when something went wrong in the middle of an ordinary life. Alan Westbury had worked in patient transport and support there for 9 years. He was 54, lean from walking 12-kilometer shifts, and he wore the pale blue uniform with the same unself-consciousness he brought to everything else. It was what the job required, and so he wore it. His marriage had ended 4 years earlier, not because anything catastrophic had happened, but because he and his wife had run out of common ground somewhere between his mid-40s and the kids leaving home, and the map she'd drawn for herself didn't have his name on it anymore. He had taken the news the way he took most things, quietly, with a period of reorganization, and without bitterness. He lived alone in a 2-bedroom in the Fairfield neighborhood. His truck had 112,000 kilometers on it, and one headlight that had started flickering in November and that he kept meaning to replace. He bought his groceries from the discount aisle because the full-price aisle made no sense to him, and he had never once mentioned this at work because work was work and his finances were his own business. What the staff did notice about Alan was different. They noticed that he remembered which patients needed an extra blanket and which ones needed the corridor lights dimmed before transport. He knew the woman in oncology who got nauseated from elevator smells and always took her to imaging via the stairs, even when that added 7 minutes to the round trip. He knew the old man in 4B who counted the ceiling tiles out loud during transport because it helped him manage his anxiety, and Alan had learned the count alongside him so the man didn't have to do it alone. He had never once mentioned any of this. It cost him time, and the time was his to spend. The new patient flow manager had arrived 14 months before the morning. Everything changed. Gail Tremblay was 46 precise, and had come from a regional health authority in Alberta, where her department had improved throughput metrics by 31% in 2 fiscal years. She cited this achievement in every meeting, as naturally as some people reference family photographs. She had a tablet she carried everywhere, and the tablet had the numbers on it. Average wait time, bed turnover, patient transit time, department clearance rate. These were the measurements she reported upward, and they were the only measurements she considered real. She identified Alan within her first month as a problem. Not the kind that appeared on spreadsheets. He cleared his assignments on time, and the patients never filed complaints, but the inefficiency kind. The sort that doesn't register until you stand at the end of a corridor and watch someone spend 4 minutes with a frightened 80-year-old woman when the transport window was 2. She had documented it twice in his personnel file. She had told him, once in the hallway and once in a formal sit-down with HR, that the role of patient transport did not include counseling, that counseling was for social workers and chaplains, and that his job was movement, not comfort. Alan listened both times without arguing, because arguing with Gail Tremblay had the same effect as arguing with a weather report. She was going to keep reading the same numbers regardless. 3 members of the support staff had begun modeling themselves after her interpretation of the job. A younger man named Tyler, who ran linen services, had started timing his corridor crossings with his phone and narrating the results to anyone nearby. A woman on the admissions desk had started rolling her eyes at patients who asked more than 2 questions. A charge nurse on the 3rd floor named Colleen Wyatt, who had worked at the hospital for 16 years, had begun echoing Gail's language about non-essential interactions and flow interruption in team meetings. It is worth understanding that Colleen was not a cruel person. She was a person who had learned, over 16 years, that the path of least resistance ran straight through agreeing with whoever held the budget reports. The building had taught her that, and she had learned it, and nobody had ever asked her to do otherwise. Gail used Alan the same way a tide uses a rock, not through intention but through persistence. Staffing ran short, she called him. When the schedule didn't accommodate a double-booked imaging suite, she rearranged it and his name ended up on the extra shift. She had never acknowledged this in writing, and when Alan mentioned the pattern once to the department coordinator, the coordinator said he understood and then changed the subject. Alan kept doing the job. Some stubborn, practical part of him believed that doing it well was a kind of argument, even if no one was listening. The morning of the 17th of October arrived gray and cold, with the particular West Coast wetness that doesn't feel like proper rain but soaks through a jacket in 10 minutes. The hospital was in the middle of its Tuesday intake rush, the waiting rooms filling early with the weekend's accumulation of aches and falls, and things people had waited until Monday to address. Alan was returning from his second completed transport of the morning when he came through the East Wing and noticed the man in the flannel jacket. He was sitting in the third chair from the end, outside the cardiology waiting room, which was an odd place to sit because the corridor wasn't officially a waiting area. Just a row of chairs left over from a renovation that had never quite finished. The man was in his late 50s, with the kind of face that had spent most of its life outdoors. Deep lines around the eyes, short gray hair that had been left to its own devices. His jacket was a red and black Mackinaw that looked like it had come from the decade before the current one, and his boots were work boots, salt-stained at the toe. He had nothing with him, no bag, no phone visible, no coat folded over his arm. He was sitting with both hands rested on his knees, looking at the middle distance with the expression of a person trying to locate himself in a situation that has become harder than expected. Alan had transported enough patients in enough states to know when someone needed a form and when they needed a person. He parked his cart and walked over. The man's name was Keith Balfour. He offered it plainly when asked, without elaborating, and said he thought he might need a few minutes before he figured out where he was supposed to go. He'd come in for a follow-up appointment, he said. His chest had been doing something strange for the past week. His family doctor's office had told him to come in, but hadn't given him a department name, just the address, and now he wasn't sure whether to register at the main desk or come directly to this wing. Alan told him the main desk was the right first stop and offered to walk him over. Keith Balfour looked at him for a moment in the way people look at unexpected kindness. Not with suspicion, but with the careful assessment of someone testing whether a step will hold before committing their full weight. He said he'd appreciate that. They were standing when Gail Tremblay came around the corner with the tablet under her arm, and the expression she wore when the numbers were making her feel the building owed her something. She didn't speak to Keith. That was the thing Alan would think about for a long time afterward. She looked at the man for perhaps half a second, registered the flannel jacket and the work boots, and turned her full attention to Alan. "You're on active transport," she said. The tablet came up slightly, the same gesture as presenting someone with a bill. Alan said he was returning from a completed run, and that this gentleman needed direction to admissions. Gail's voice didn't rise, exactly. It sharpened. "That is not your assignment. That is what volunteers are for, if any are available, and if not, that is what the desk staff is for." She glanced once at Keith Balfour, briefly, in the way you glance at something you've already categorized. And what she said next was addressed to the middle of the corridor rather than to the person being discussed. If someone can't navigate from the entrance to the registration desk without assistance, that's a pre-arrival support issue. That is not an acute care resource. Direct him to the information board. The information board was at the far end of the East Wing, behind a fire door and around a corner that wasn't clearly signed. Alan had watched fully ambulatory patients miss it on quiet days. A man who had come in alone, uncertain of where to go, with a week of cardiac symptoms, was going to miss it on a Tuesday morning. Keith said nothing. He watched Gail Tremblay with an expression that Alan couldn't fully read, not wounded, not angry, something more considered than either. Alan told Gail he would be 3 minutes. She told him that was not his call to make, and that she had documented 2 prior instances of what she termed role deviation, and that a third would go to the department director as a formal pattern. He said he understood. He turned to Keith Balfour and said, "Shall we?" and they walked down the East Wing together. The tablet came down hard on the nurse's station counter as they rounded the corner. Gail told Colleen Wyatt to note the time. Then she went to find the department director. Alan walked Keith Balfour to the main registration desk and waited while the clerk pulled up the appointment. It was there in the system, a referral for cardiac assessment, sent from Keith's family physician the previous Thursday. The clerk looked at Alan with mild confusion. Patient transport wasn't typically part of this process, and Alan said the gentleman had been having some difficulty navigating, and he'd simply wanted to make sure he got sorted. He asked Keith whether there was anyone he'd like called. Keith said his daughter knew where he was. He said it the way people say things when they want to convey they're fine without making a production of it. Alan nodded. He told Keith the cardiology waiting room was on the 3rd floor, and that there was an elevator at the end of the main corridor. Keith looked at him with that same careful quality and said he thought he'd be all right from here, but that he was grateful. Alan went back to his cart. His next assignment was in the system. He clocked it and started down the hall, and the thought crossing his mind was practical and specific. If the 3rd documented instance went to the director would read Gail's framing of it, and Gail's framing was always internally consistent and technically true in the way that a sentence is true when it contains no lies but no context. The call came before he reached the imaging suite. It came through his supervisor, a man named Dave, who had been at the hospital longer than Gail, and who had spent 14 months in the uncomfortable position of existing between the two of them. Dave found Alan in the hallway and said it quietly, with his shoulders doing the apologizing his voice couldn't quite manage. Gail had gone to the director. The director had reviewed the file and agreed the pattern warranted action. Alan was to finish his shift but was not to return pending an HR review, and the outcome of that review, Dave said, looking at the wall somewhere to Alan's left, was unlikely to go in his favor. Alan asked if it was done. Dave said he was sorry. He finished the shift because leaving mid-assignment would have been wrong for the patients who still needed him, and because some fundamental part of him refused to let the last thing he did in that building be walking out of it early. He cleaned and returned the transport cart. He handed in his badge and his access card. He retrieved his jacket from the staff locker and left through the side entrance, where the recycling bins were and where no one would notice. It was 20 minutes to 4 in the afternoon. The sky had gone from gray to a darker gray, and the ocean's smell was stronger. He sat in his truck in the staff parking lot without starting it. He had been in that hospital for 9 years. The thought he kept returning to was not about Gail Tremblay or the HR review or the file with 3 documented instances of role deviation. It was simpler than that. He had watched a man in his late 50s sitting alone in a cold corridor with something wrong with his heart, and he had helped him find the right desk. He could not locate the angle from which this was wrong. He had looked for it, sitting there in the truck, and he had not found it. He looked for work for 6 weeks. The first 2 were ordinary enough. He had 9 years of hospital experience, a current first aid certification, and references from nearly a decade of doing a job without complaint. He applied to 3 health region facilities in Greater Victoria, a long-term care home in Saanich, and a private medical transport company that ran between the island and the mainland. The long-term care home called back quickly. The interview went well. The administrator told him they'd been looking for someone exactly like him, and that he should expect to hear about orientation dates by the end of the week. He heard from them the following Thursday, a different voice. It said the position had been filled through an internal posting. The health region facilities went quiet after the reference check stage. One of them, a smaller clinic in the gorge, sent a form email saying the role had been closed. The private transport company interviewed him twice and then stopped responding to his messages. In the 5th week, a phone call came from the admissions manager at a rehabilitation center in Esquimalt. She told him, with the slightly pained directness of someone doing a stranger a favor, that she had called his previous employer for the standard employment reference, and had been told by the patient flow department that Alan Westbury had been terminated following a pattern of insubordination and repeated failure to follow clinical protocols. She said she was sorry and that she hoped he found something. He sat on the back steps of his house in Fairfield for a long time after that call. The November light had gone flat and early. He thought about the word insubordination applied to walking a man to the registration desk, and then he stopped thinking about that because the useful part of thinking ends somewhere, and what comes after it isn't useful. By the 7th week, he was doing arithmetic that resolved to the same number no matter how he approached it. He had savings, but savings have a bottom. The truck payment was fixed. The flickering headlight was still waiting on him, and now the rear wiper had started going as well, and he had begun categorizing everything by what could wait and what couldn't. He sat at his kitchen table one night with the column of numbers in front of him, and he asked himself the question plainly, the way you ask a question when you've run out of room to dress it up. If he had known, on the morning of the 17th of October, that helping Keith Balfour find the admissions desk would cost him his job and 6 weeks of his savings and the professional reputation he'd spent 9 years building, would he have done it? He sat with the question for a long time. What he arrived at, alone in his kitchen with a headlight he couldn't afford to fix, and a list of things he still had left to sell, was that the answer was yes. Not because he had expected anything from it. He had expected nothing. He had not given Keith Balfour's flannel jacket, or his salt-stained boots, or his uncertain expression, a single thought beyond what was immediately in front of him. A man who needed pointing in the right direction. That was the entire account. And he could not make it be wrong, regardless of how many numbers he put beside it. The letter arrived in the 3rd week of November, delivered by a courier who needed a signature and who waited with the impatience of someone making 30 stops before noon. The envelope had a law firm's name on it that Alan didn't recognize, and inside was a single page in careful legal language saying that the firm represented the Balfour Medical Foundation, that the foundation was conducting a review of patient service standards at several BC Health Region facilities, and that as part of that review they had reason to believe Alan Westbury's employment circumstances warranted examination. They requested he make himself available for a conversation at his earliest convenience. He read it twice. He assumed, with the resignation of a man who has spent 6 weeks on the wrong end of institutional language, that this was liability management, that a foundation had become aware of a termination and wanted his signature on something that would make the hospital's version of events official. He called the number anyway, because he had nothing else scheduled. The lawyer's name was Andrea Caldwell, and she was not interested in obtaining his signature. She asked him specific questions about the morning of October 17th. The corridor, the man in the flannel jacket, the exchange with Gail Tremblay. She asked them in the order they had happened, and she did not lead him anywhere. She listened to his answers, asked 1 or 2 clarifying questions, thanked him, and said someone from the foundation would be in touch within the week. He didn't fully understand what had just happened until 4 days later, when a second call came asking whether he would be available to attend Victoria Care Center the following Tuesday at 9 in the morning. He was asked to come to the main entrance. He arrived at 10 to 9 and stood in the parking lot wearing his good jacket. Not a uniform, just a jacket, and tried to find an explanation for why a medical foundation's law firm wanted him at this specific place at this specific time. He could not find one that held together. The vehicles arrived at 9:10. 2 black cars, moving with the particular deliberateness that suggests the people inside have a clear destination and are not uncertain about it. They parked along the front of the building in the administration spaces. Men and women in dark coats got out carrying document cases and moved toward the entrance with the efficiency of people who have done this before. And then, from the second vehicle, stepping down onto the wet asphalt with the unhurried movement of a man who sees no reason to rush anywhere, Keith Balfour. He was wearing the same Mackinac jacket, or one very like it. He looked across the parking lot and found Alan without effort, the way a person finds something they have been looking for. He gave a small nod. Alan Westbury had spent 6 weeks certain that Keith Balfour did not know his name, had no way of knowing it. He had been wrong about that from approximately the moment he had introduced himself outside the cardiology waiting room. Inside, in the main conference room, the regional director and 2 hospital board members had been asked to attend. Andrea Caldwell presented the documentation without theatrics. The Balfour Medical Foundation had contributed to the operating budget of Victoria Care Center for 11 consecutive years. Keith Balfour had established it following his wife's treatment at a regional hospital in Ontario in 2009 and had served as its chairman ever since. He had made a practice in those 11 years of visiting recipient facilities unannounced and without identification, because announced visits produced performances rather than evidence. He had taken particular interest in how facilities treated patients who did not appear to have money or connections, because those patients were the ones most likely to tell him what a building was actually like when no one important was watching. In the weeks since October 17th, the Foundation's legal team had reviewed 19 months of staff conduct records, patient complaint logs, and internal communications from the patient flow department. What they had found was not an anomaly, it was a pattern. Patients who had expressed difficulty navigating the facility had been redirected to self-service information without assistance on at least 30 documented occasions over 14 months. 3 formal patient grievances referencing dismissive treatment had been filed and then reviewed and closed by Gail Tremblay within her own department, because she had the authority to do so without corrective action, because closing them quickly kept the throughput numbers clean. Alan's termination file was placed on the table. The words insubordination and role deviation and failure to follow clinical protocols were read aloud from the document Gail had written. Then Andrea Caldwell described the security footage from October 17th. A man arriving in the East Wing, sitting alone for 43 minutes, a hospital employee stopping to help him, a department manager intervening to end the interaction, and subsequently initiating the employee's termination. Gail Tremblay sat at the far end of the table with a folder in front of her. She had brought it herself, the way she always came prepared, and it stayed closed throughout. The regional director terminated Gail Tremblay's contract effective that morning for conduct inconsistent with the institution's patient care obligations and for documented misrepresentation in a personnel action. The legal team had also reviewed the 4 positions Alan had applied for following his dismissal and had obtained, in 2 of those cases, written confirmation that the reference provided by the patient flow department had materially mischaracterized his employment record. 2 additional staff members involved in the documented pattern were addressed separately through the hospital's existing HR process. Keith Balfour had not spoken once during the proceedings. When the documentation portion ended and the room rearranged itself slightly, he rose and walked to where Alan was sitting and looked at him with the same careful, assessing quality Alan remembered from the corridor outside cardiology. He said he had asked about Alan every week for 6 weeks and that the hospital had held no forwarding information for him. He said that was something they intended to address structurally. He said he owed Alan an apology for how long it had taken. Alan said there was no apology owed. He had done what he would have done for anyone in that corridor who looked lost, and he had known while he was doing it that the documentation would go somewhere he couldn't follow. He had done it anyway. He didn't require it to have been noticed. Keith looked at him for a moment. Then he said he understood that, and that it was precisely why he had spent 6 weeks making sure it was. What followed was transactional and took less than an hour. The wrongful dismissal settlement was documented and signed. Uncompensated shift extensions over the previous 2 years were reconstructed from badge access records and scheduling archives, with penalty interest applied. Alan read the final figure twice. It was larger than he had prepared himself for. Then Keith Balfour sat down across from him and said the thing he had come to say. The Foundation was restructuring its grants to include a patient experience requirement for all recipient facilities. They needed someone to help develop what that requirement actually looked like on the floor. Not in a policy document, but in a corridor, at a registration desk, in a transport chair at the end of a long hallway. Someone who understood it from the ground up rather than from a conference room. He said plainly that he was not offering it as a thank you. The thank you was the settlement, and it was already paid. What he was offering was a job, and it was a job because he hadn't been able to find a more qualified person to do it. Alan said he'd like a few days to think it through. Keith said he'd expected that. Alan thought about it for 3 days, which was roughly how long it took to be certain of his reason for accepting. He called with one condition, which he stated as a condition rather than a request. The framework had to be built for every level of every building, not just management, the nurses who had started echoing the wrong language, the orderlies who had started timing themselves, the ward clerks who had learned to look past the person standing in front of them. They hadn't created the culture, they'd inherited it, and they'd adapted to it, because adapting was easier than being on the wrong end of it. That was something you could actually change, if you were willing to start with what got measured. Keith agreed before Alan finished the sentence. He started in January. The first 2 months were unglamorous. He sat with people in the roles he'd held himself. Porters, attendants, registration clerks, food service workers, and asked them what made the job harder than it needed to be, and what they'd change if the change were available to them. He wrote everything down and took it seriously, and when he brought it back to the policy discussions, it changed what went into them. The measurement framework shifted first, because he had learned in 9 years behind a transport cart that people do exactly what gets counted. Patient movement time stayed on the report. What went above it was patient experience score, unresolved complaint rate, and a new category no one had tracked before, the number of staff interactions that resulted in a patient finding what they needed. The change happened quietly, without announcement, but within 2 quarters, the floor behavior at the pilot facilities had shifted in ways that appeared in the numbers, and also in the way the corridors sounded. He delivered the first training sessions himself. He was asked, more than once, to tell the story of October 17th directly. He declined each time for the same reason. The man it had happened to had spent 11 years arranging things so that no institution would know who he was, and using his experience as a teaching example, without asking, felt like exactly the wrong lesson to build a training around. What he told instead was simpler. A man was sitting alone in a corridor. Someone asked if he needed help. That was the whole story. It was enough. Colleen Wyatt attended the 3rd session at Victoria Care Center. She sat in the front row and, at the end, asked the only question that mattered. What should she have done on the morning of October 17th, when she had been standing at the nurse's station and had watched the whole thing happen without saying a word? Alan told her the honest answer. One person saying something out loud would have been enough. Not a confrontation, not a formal objection. Just a voice in the room that made clear the silence wasn't unanimous. That was the entire reason they were all sitting there, and also why the silence was the specific thing he most wanted to change, because silence is the part that feels safe, and it is the part that lets everything else continue. 6 months after the first pilot session, the patient experience scores had moved enough that the Regional Health Authority requested a meeting about expanding the framework across the province. Keith Balfour kept visiting hospitals. He still wore the Mackinac jacket when he did, and he still arrived without identification. He had explained once to Andrea Caldwell, when she had asked why he didn't at least carry something that established who he was, that the day he started announcing himself was the day they would start performing for him, and he was only interested in how a building behaved when it believed no one important was paying attention. Alan had thought about that for a long time. By the end of the first year, he understood what had actually changed his life, and he was clear about it in a way he hadn't been on the night he sat at the kitchen table with his column of numbers. It was not the cars in the parking lot, not the law firm, not the settlement or the new role. Those were the consequences of something much smaller and much earlier. A man had been sitting alone in a cold corridor, and the only question available had been whether to stop or keep walking, and Alan had stopped. That was the complete account. He had stopped without knowing who the man was, without weighing what stopping might cost. And it had cost him everything he had for 6 weeks, and he would make the same choice again without hesitation. And he knew it with the particular certainty that only arrives after all the arithmetic has run out. There is no formula for that kind of decision. It doesn't calculate. It doesn't weigh the odds or wait for the safe outcome. It simply recognizes a person who needs something and moves toward them, and then it lives with whatever comes next. That is what it looks like on an ordinary Tuesday morning in a corridor with bad lighting when someone decides to be decent without a reason.